Good afternoon, everyone. Today we will be walking you through the anatomy and physiology of a normal swallow. This is a vital and important function that most of us will often take for granted, but one that requires coordination across multiple systems. This presentation is being presented by Rebecca Gavrila, Leanne Moreno, and Brooklyn Christensen. As SLPs and healthcare providers, knowing and understanding each phase of the swallow is key for not only diagnosing but treating dysphagia appropriately. We are also going to be educating caregivers, patients, and many members of various teams as we treat patients. The swallow is normally divided into 4 stages. This includes the oral preparatory phase, the oral transit phase, the pharyngeal, and the esophageal. So let's get started.
Okay, so the oral preparatory phase of swallowing is a voluntary stage where food or liquid is introduced into the oral cavity and prepped for swallowing. Several key structures are activated here: the lips, the tongue, the hard palate, the teeth, the buccal muscles, and the salivary glands. Upon entry, the facial nerve, that is cranial nerve number 7, activates the orbicularis oris for lip closure and the buccinator muscles to prevent bolus pocketing in the lateral suci. With the oral cavity sealed, mastication begins. The masseter, medial pterygoid, and the temporalis, all innervated by the trigeminal nerve number 5, are responsible for jaw closure. Meanwhile, jaw opening is coordinated by the lateral pterygoid and suprahyoid muscles. The tongue is primarily under control of the hypoglossal nerve, that's cranial nerve number 12, while that mixes and shapes the bolus. The submental muscle stabilizes the floor of the mouth, supporting the tongue-palate contact. And importantly, the stage is governed by the central pattern generators in the brainstem, coordinating the cranial nerves 5, 7, and 12. Saliva also plays a critical role here. The parotoid gland is stimulated by cranial nerve number 9, and the submandibular and the subliminal glands by cranial nerve number 7. And this ensures enzymatic breakdown and bolus cohesion. So next up, we'll go on to the oral transit stage.
The next phase is a voluntary phase called the oral transit phase. This phase usually will last about 1 second. The bolus that we were previously speaking about in this phase is propelled posteriorly from the oral cavity to the oral pharynx. This movement is driven by both intrinsic and extrinsic muscles of the tongue. The intrinsic muscles are comprised of the superior and inferior longitudinal, the transverse, and the vertical. These are responsible for shaping the tongue. And the extrinsic include the genioglossus, the hyoglossus, the styloglossus, and the palaetoglossus, which are for broader gross control lingual motions. All but the palaetoglossus are innervated by cranial nerve 12, the hypoglossal nerve. The palaetoglossus is innervated by cranial nerve 10 via the pharyngeal plexus, and cranial nerve 10 is the vagus nerve. The bolus is then pushed along in a wave-like motion that goes from anterior to posterior against the hard palate, while the soft palate is elevating itself to seal the narrow nasopharynx to prevent nasal regurgitation from happening. This is achieved by the aid of the levator veli palatini, which is innervated by cranial nerve 10, the vagus nerve, and the tensor veli palatini by cranial nerve 5, which is innervating it, which is the trigeminal nerve. This phase will end when the bolus passes through the anterior falcial pillars or through the ramus of the mandible, which will then trigger the pharyngeal swallow reflex, which goes into our next phase.
Okay, so the pharyngeal stage is an involuntary phase and it lasts around 1 second. The primary goal is to protect the airway while propelling that bolus to the esophagus. So there are 4 coordinated events. First, the soft palate closure. So the tensor veli palatini tenses the soft palate, and the levator veli palatini elevates and retracts it. The musculosus uvula adds midline bulk to seal the velopharyngeal port. Next up, we have the laryngeal elevation. The larynx moves upward and forward under the epiglottis. This movement is driven by the suprahyaloid muscles, digastric, mylohyoid, the stylohyoid, the geniohyaloid, and there's more. They're innervated by the cranial nerves 5, 7, and 12 along the cervical spinal nerve C1. Airway protection via 3 levels of closure. So we have the epiglottis that inverts, guided by the aerial epiglottic and the thyroepiglottic muscles, those by the vagus nerve. The false vocal folds will approximate, and then the true vocal folds adduct via the lateral cryoarytenoid and the transverse and oblique arytenoids. And those are all innervated by the recurrent laryngeal branch of the vagus nerve. Next, we have the pharyngeal constriction. The superior, middle, and inferior constrictor muscles contract in a sequence, so they create a wave propelling the bolus downward. These muscles are innervated by cranial nerve 10 and cranial nerve 11, and those are via the pharyngeal plexus. Sensory input from the fascial pillars, the soft palate, and the tonsils is carried by cranial nerves 7, 9, and 10. Next up, we'll have the esophageal phase.
The final phase is the esophageal phase. This is an involuntary phase that is controlled under the autonomic nervous system and is primarily mediated by cranial nerve 10, which is the vagus nerve. In this phase, the bolus will enter into the esophagus when the cricopharyngeal relaxes. This is also aided by the hyolaryngeal elevating. Once inside the esophagus, peristaltic waves will take over. The waves occur within the esophageal wall. The wall is consistent of 2 layers. The first layer is an inner circular layer that will constrict behind the bolus, and an outer longitudinal layer that shortens the esophagus ahead of the bolus, causing the peristaltic wave. The esophagus has 3 muscular areas. The upper third is comprised of striated or skeletal muscle and is innervated by the vagus nerve, cranial nerve 10, via the recurrent laryngeal branch. The middle third, which is mixed with striated and smooth muscle, and the lower third, which is smooth muscle, also under autonomic control of the nervous system and innervated by cranial nerve 10. Finally, the lower esophageal sphincter will relax to allow the bolus to enter into the stomach and recontract in a timely manner to prevent reflux from happening to the patient.
Hi, I want to take a few minutes to explain how swallowing actually works and the process that it is. Swallowing may seem like a very simple, mindless task. However, it is a complex system of 4 different stages that involves so many different muscles and nerves working together to create a safe swallow. The swallowing process, it can last just a few seconds, or it can last longer than a few seconds, all depending on how your swallowing systems are working. Every time that you take a bite of food or you drink some water, all of these systems need to be working properly to ensure a safe swallow. So I want to take some time and explain all of these different phases of the swallow to help you understand what having a normal, safe swallow means. Okay, so the first phase that I want to talk about is the oral preparatory phase, or that getting ready phase. This phase is where swallowing begins. When you take a bite of food or a sip of liquid, your lips and your teeth, your tongue and your cheeks, they're all going to start to work together to move around whatever is in your mouth and create a small ball. We can call this the bolus or just the substance. It's going to form into a ball. As this ball is forming, your saliva is going to start producing, and this helps form a soft and wet ball of food, and this just makes it easier to swallow. This stage is super important because it's what prepares the food or the substance to make a nice, safe trip down your throat. you are actually in control of this phase. So you are totally aware of what's going on. And this phase can last however long it takes you to chew. If you're chewing something that is more dense, it might take longer. Or if you're just taking a sip of water, it might be pretty quick. All right, so the second phase is called the oral phase. This is still happening in your mouth, but this is the process of when your tongue starts to move it back. So we're calling this phase the moving it back. Once the food is ready, your tongue is going to start to take that bolus or that ball of food and move it to the top and the back of your mouth. At this point, you're still in control. However, it's a little less. It's less mindful. It's kind of an automatic process. And as you slide that food to the back of your throat, the roof of your mouth is going to send a signal to your brain to kind of close off the space that can go to your nose. So this protects your nasal passages, or to make sure that nothing gets up there. This is a pretty short step, but it is important into making sure that the food starts heading down the right path. So your tongue is just pushing it towards the back of your mouth, getting ready to swallow. All right, so this third phase is called the pharyngeal phase. This is also the safe swallow phase. This is the phase where you want to make sure you're protecting your airway and that the food is going in the right way. This is when the swallow becomes really involuntary and automatic. It's up to your brain and your muscles and your nerves to remember the right things to do. So once that bolus or that food enters your throat, a lot of different protective measures are going to start happening. The most important thing is closing that airway. So your airway and the pipe where the food goes down, they're really close together. So what we want to happen is this little flap called an epiglottis is going to close and cover that airway. Now the food can fall into the right pipe. This will protect your lungs, and just you want it to go down the right pipe. I think that we all know what it feels like to have something go down the wrong pipe. You want it to go down the right pipe. At the same time, the muscles in your throat are going to squeeze and push the bolus down towards your esophagus. So this phase is also really quick, but it is one of the most crucial to protect your airway and make sure that we have a safe swallow. Okay, so now we are entering that fourth and final phase of swallowing called the esophageal phase. I like to think of this phase as the to your stomach phase. This is the final phase. The food has gone from your mouth to your throat, protecting your airway, going towards your stomach where you want it to go. This is when it starts entering the esophagus. This is just a muscular tube that connects your throat to your stomach. The muscles in the esophagus, they kind of work like a wave. So they are going like this and pushing that bolus or that food downward. A muscle at the bottom of your esophagus is going to relax to let the food pass into your stomach. And at this phase, you are also no longer in control. This is all automatic with your brain and your muscles and your nerves. This step is usually silent and unnoticed. We're normally not feeling it at all unless something is going wrong. So this phase can last between 8 to 20 seconds, depending on what you're swallowing. In summary, swallowing may seem automatic, but it is a very coordinated process. It takes a lot of muscles and nerves, and it is something that we don't think about until something goes wrong. So now that I've explained a normal, safe swallow, hopefully you understand a little bit more about what's going on in your body when you are swallowing. Thank you.
In summary, the normal swallow is a complex but beautiful and timed sequence of voluntary and involuntary movements that are reliant on a person's muscular activity and cranial nerve coordination. As clinicians, understanding these mechanisms at this level equips us to better be able to identify and treat disorders across all 4 stages, and not only to speak to patients effectively, but to speak to other members of the medical team. We thank you so much for your attention and joining us for our presentation on the normal swallow.